3 months ago, we brought you the story of how MEPs were trying to create new rights for citizens to be able to travel to another EU member state for medical treatment. Well, since then, the Parliament has come to an agreement with the Council on the principle of so-called patient mobility. And this week here in Strasbourg, MEPs have approved a package of measures that aims to enable Europeans to be able to travel to a member state other than their own in cases where they would face an undue delay or a lack of options at home. The principle of patient mobility was established several years ago by the European Court of Justice. Judges ruled that a British woman who travelled to France for treatment because she faced a long wait for an operation in the UK was entitled to be reimbursed the cost of her treatment by her local health authority. MEPs and member states have been trying to reach agreement on the extent and application of this right. When we last reported on this back in October, there were still some areas of disagreement. So how were they overcome? Françoise Grossetête is the Parliament's rapporteur on this legislation.
The vote in the Parliamentary Committee was a very important and massive vote. It gave me a strong mandate to negotiate. I was effectively sent on a mission by my colleagues, and we had an enormous amount of meetings, not only with the Belgian presidency, but with the permanent representations of member states. We tried to find out what issues were of particular concern to the various individual member states and tried to resolve these problems so that whenever we negotiated, we always had something to propose.
Madame Grossetête told EPP TV that this legislation marks a major step forward for Europe's citizens.
Finally, we are clearly defining the right of patients to access cross-border healthcare, which means having the best possible information on the treatment they can access in a member state other than their own. And that's really important because we've seen a certain number of cases going before the Court of Justice, and it was the court that was making the law. So the time came when the Parliament, as a legislative body, had to seize the opportunity, and that's what we've accomplished today.
This new legislation gives patients a right to claim reimbursement for different kinds of treatments carried out abroad. National contact points will also be established in each member state to help patients and inform them of their rights. But although this legislation creates new rights, it is also designed to prevent abuse of Europe's already stretched national health services by so-called medical tourists.
This legislation indeed creates new rights for patients, but above all, it's not designed to promote medical tourism. With the requirement for an agreement in order for a patient to be reimbursed, with the requirement for a member state to give prior authorisation for hospital treatment abroad, with the safeguard clause that allows member states to control the planning and the management of their healthcare and infrastructure, all this acts as a guarantee against medical tourism, and that's very important to explain.
This is the bridge across the River Rhine, linking France with Germany. And it's in places like this, where cross-border healthcare is already commonplace, that this new legislation is most eagerly awaited. For more information on our group's policies and activities, please visit our website, eppgroup.eu. Thanks for watching, and see you again soon.